Malaria, it is a mosquito-borne febrile illness. Febrile means a fever-causing illness. It is generally spread by the bite of a female anopheles mosquito, and it usually spreads around the rainy season when the number of mosquitoes are really high. Whenever you have malaria, a person will generally experience fever. It is associated with chills. A person will have a tendency to shiver a lot. So there are basically four varieties of malaria, which are caused by different types of mosquitoes. In a few varieties, patient will have fever from 2 to 3 days, while in a certain varieties, there would be a period of 4 days, which is called as tertian malaria, in which you will have a four symptomatic day period, and then it will be a relief period after that. So it depends on what kind of malaria you have. A patient will also have body ache, chills, and general tendency to vomit, abdominal pain. While in children, they usually have a general flu-like illness. The symptoms are pretty vague in kids. First of all, whenever you will present to your doctor with a case of fever with chills, your doctor, based on the clinical history, will certainly diagnose you with malaria. However, an adjunct of certain tests like rapid diagnostic tests are available to detect the malarial antigen. Nowadays, RT-PCR to diagnose malaria has also been included, but since the test is very costly, so we generally rely upon the antigen-based tests. Another simpler way is doctor will take out your blood and will make a peripheral film. By using the microscope, we diagnose the malarial parasites. So if we find the malarial parasites, so you definitely are a case of malaria. Basically, the treatment of malaria usually involves three goals. The first goal is to alleviate the symptoms of the patient. Since the parasites are living in the blood of the patient, the first aim is to kill the parasites. So we usually give artemisinin-based combination therapies. The treatment is usually of 14 days. So the next goal is to prevent the spread of the infection and to prevent the relapse. There are certain varieties of malaria in which the mosquito lives silently in the liver. We treat it, and then after a few days it comes back. So to prevent that, we usually give another drug so that we kill the silent forms of the malarial mosquito also. You should keep in mind that if you're pregnant, in the first 3 trimesters, the same drugs are never given to the patient. So always keep in touch with your doctor and what all the diseases you suffer from, so that you can be treated adequately. And also, if you're traveling to a country which has a lot of malaria, it is an endemic place, especially the tropical countries. Then doctor will give you a prophylactic medication which will start 2 days before your travel and will end 4 days after your travel, till the time you are in that particular place. If a person does not take treatment timely, or if a person does not keep in touch with his doctor, then a person might land up in certain complications. However, even on treatment, I've seen a few cases which have deteriorated really fastly. So the basic complications or the danger signs that you must know are stomach ache. If you feel tenderness in your stomach, or if you feel a lot of bloating, please inform your doctor. If you feel a lot of headache, severe letharginess, that is you're unable to get up from your bed, a severe headache, or if your patient or if anyone in your family, God forbid, suffers from it, and he has symptoms such as altered mental state. He keeps on blabbering something, does not understand what you're saying. So it is a complication. Patient might have jaundice. Patient might have really enlarged spleen. The patient might also land up in coma. So please take the treatment cautiously and carefully. This is the most important part for all of you to listen. The diet that should be given to the malaria patients. First, I'll tell you what all you have to avoid. So please avoid oily food, fatty food, any food which has a lot of dairy products in it. Avoid a lot of citrus items like lemonades or anything that involves a lot of sour things. Okay. Then what all you should also avoid caffeinated drinks. Tea and coffee, these should be avoided. These generally increase your blood pressure. And since we want the patient to be in a very stable condition, so kindly avoid caffeinated drinks or cold drinks, and avoid alcohols also. If you're addicted to any substance, please avoid that also. Now, what all you have to take? The primary aim of any malarial or any mosquito-borne disease is to keep adequate hydration. So keep drinking adequate amount of water. Coconut water, it is a great source of vitamin A and E. So I would suggest that include coconut water in your diet. Plus, it keeps you hydrated for a longer amount of time. Include green leafy vegetables in your diet. Please avoid capsicum, turnip, and cabbage, as these are inflammatory vegetables. These might increase the bloating and abdominal tenderness in your body. So kindly avoid these for a period of 2 weeks. Include adequate rest in your along with your diet. Keep focusing on light food. Avoid fried items and items which have a lot of fat. Eat milder meals, like eat khichdi, eat soups, eat dal or roti soaked in it. Avoid anything that it is harder on your stomach, because right now your body needs energy to digest, to fight malaria, rather than digesting your hard food substances. The treatment of malaria lasts for about 14 to 15 days, and this is the time in which the patient gets better. If a person bites anyone today, so in a period of 10 to 15 days, a patient would take in general to develop the symptoms. So this is the period which is known as incubation period. Patients usually come to us on the 14th or the 15th day, when the patient really cannot treat their fever themselves. So from this point, the patient might have his symptoms completely gone in 14 to 15 days. And after that, there is general letharginess. So you can consider another week for the patient to recover in a fine state of health. Malaria patients, I've usually seen these patients have chronic fatigue. They always feel tired after malaria, and the main part is maintain your nutrition and adequate diet. That will help you in treating this fatigue. Some patients usually have muscle cramps also. I've seen patient coming complaining of muscle cramps 2 to 3 months after malaria. So please visit your doctor in case you have it. Rest, take adequate vitamin D, sun exposure in the morning hours, and rest is your adequate nutrition. That will help you in alleviating these post-malaria symptoms. It is also known as post-malaria fatigue syndrome. So it's just your adequate diet and nutrition that will help you get over it. Prevention is always better than cure, and obviously it is less costlier also. So first of all, since it is spread by a mosquito bite, so avoid any place where mosquito can breed. So avoid any place where which contains water. Avoid stagnant water. Avoid any kind of water in open place. Keep cleaning your water storage areas, like water coolers or any desert cooler if you have. Then another thing is try wearing long sleeve clothes, especially when you see it is rainy season and people are prone to get malaria or any other mosquito-borne disease like dengue. Try wearing long sleeve cloths. Use insect repellent nets. Nowadays, even the government provides insecticide treated bed nets. Try those. Use those. I would definitely suggest you using mosquito repellents, which are easily available in the market. Use door covers and window covers. These are the basic things that you have to avoid, and obviously keep hydrated. And if you have any symptom, definitely visit your doctor. Malaria and dengue both are caused by mosquito bite. However, malaria, it is caused by a parasite, while dengue, it is a viral illness. So both of these definitely have fever in common, while dengue, it has a lot of added symptoms. Like in dengue, what specifically the patient has is retroorbital pain. That is pain on the eyelids. You feel that your eyelids are heavy and you have pain behind your eyes. This is a classical dengue symptom. You'll have a lot of joint pain. This is a very classic symptom of dengue again. Muscle cramps are there in both malaria and dengue. However, dengue, if you have dengue, you might have rashes on your body. Rashes, these develop when the platelets and the RBC, when your platelets are low, the patient will have bleeding in the mouth or gum. The patient might also have nose bleeding. These symptoms are usually not present when the patient has malaria. Mild or moderate forms of malaria usually do not present with these symptoms. These are classical for dengue. And malaria is causing a lot of death nowadays. Around 450,000 deaths annually are caused by malaria, according to WHO. Dengue, on the other hand, is deemed to be the fastest spreading mosquito borne infection. So, both of them you have to be wary of.